Hello, once again. It is Health Matters once again. We want to look at the World Mental Day held just some few days ago. And the theme is, or was, but I want to believe is, mental health in humanitarian emergencies. There are instances where you have accident scenes, could be fire, could be some natural disasters, some earthquake, you have floods here and there. And what is always the reaction of people? Sometimes the issues could be social. At the point they said some youth failed to pass some examination, they felt the world has come to an end. So, what would be the role of parents in that order? What would be the role of psychologists in that area? And we've also seen that in accident scenes, people are quick to start filming as opposed to providing some rescue. Why is it so? We'll come to all of this. My name is Ben Sherman, and we have an expert who will, walk us through some of these things, mental health in situations like this. I want to welcome Dr. Adatu Adamu, founder, Secure the Future International Initiative. Thank you for coming.
Thank you for having me.
Good. So let's take it like an umbrella. I'm not talking of PDP. An umbrella in its own self. Let's look at it holistically. When we're talking about the theme of this year's World Mental Day, which is mental health in humanitarian emergencies. So let's situate it in Nigeria. Yes.
Okay, so I want to believe that theme is talking about, how mental health should be prioritized. It is an emergency now. It's not one to say, oh, it's not something we should talk about. The world is saying that mental health is an emergency. If the world is losing $1 trillion, all because people are not productive as a result of anxiety and depression, then economically, then you know that this is a serious emergency. And then if the world is also saying that 1 in 8 are struggling from anxiety or depression, and Nigeria says 1 in 4 are likely to experience mental health issues, in their lifetime, that means mental health is something to really talk about. It is an emergency. We just have to create awareness. We have to talk about it. We have to get to a point where people understand it and will be able to normalize the conversation instead of running, when you find yourself in such circles and you just don't want to have conversations because of that one word, stigma. So the world is now saying mental health is an emergency and everybody has to talk about it so that we just normalize the conversation and get people to take, the basic support that they need.
So sometimes you just see government giving some priorities. They say, oh, HIV/AIDS, let's treat it as an emergency. People are now talking about kidney failures. Oh, let's treat it as an emergency. Now you have all sorts of cancers here and there. Let's treat it as an emergency. Now we're talking of mental health. So when you look at it in Nigeria, truly is government really giving attention to this area?
Well, I would say that government needs to do more. In 2023, right, a bill was passed, a policy, right? So it means that at least they are beginning to see that mental health is really important and they need to pay, more attention to it. But you see, it's important to not just pay attention to it, but to make sure that there are funding that will also support, that thing that you're, working out or trying to pay attention to. If we say that we have only or less than 300 psychiatrists in Nigeria, it's something that the government should really worry about. If we used to have 300, but now we have less than 300, where are the others? Where are they? That means they are not in Nigeria anymore, right? That's one. If we say that mental health is really what the government is seeing as priority, why are we having just 3% of the budget for health as part of mental health? So it means that they have to see that mental health is also an indicator to the GDP of Nigeria. Because when we say mental health, it is human beings that are actually working to be able to give every organization, that what they desire. You understand? And if I am saying that the world is saying that they are losing $1 trillion as a result of lack of productivity, absenteeism, anxiety, depression, economically, that means that mental health is just one thing that, should be prioritized. So we shouldn't be talking about just 3% in the budget of health for mental health. No, we should look at more for Nigerians. We shouldn't be looking at, still talking about how insurance can begin to say, okay, let's also have mental health as part of the services that we render. We should have them, in place by now. We shouldn't be saying that we have only 3 or 4 hospitals, psychiatric hospitals in Nigeria. We should have more than that. So it should be a priority. We shouldn't say that people can have conversations in the offices or by now, the government is not looking at having mental health desk or counseling, a desk in their in offices. By now, we should really say that Nigeria has gotten to a point where things are working. I just read something online, I think 2-3 days ago, and they said, in mental health, the level of mental health in Ogun State has a reason. That means that there is a document, but have we started implementing the policies? It's a question. Are people really using it? Do people even know that there's anything called the Mental Health Act? I'm not sure that a lot of people know. So we have to create awareness. Government has so much to do, but as much as government have so much to do, of course, the civil society, and community leaders would have to make, more input in this and see that it's a priority, and we don't have a choice but to just keep having conversations around it.
Now, you are mentioning of Ogun State in terms of mental health issues on the rise or increase, which also were probably followed based on this research. Some other states could also be following suit.
Yes.
So, what do you think are some of the responsible elements?
To be honest with you, I will say that it's important that we know that the economical state of, the condition of Nigerians now is enough reason for people to want to commit suicide, is enough reason for people to sink into depression and anxiety, is enough reason for people to just, fall in and out of mental disorders. So many families are dysfunctional. The style of parenting is totally different from what we used to know. What we used to know is not what it is now. It's not, parents are struggling to have conversations with their children because they are afraid, they don't want to hurt them, or they don't want to say anything that will make them, act in a certain way. We have the environmental factor. People, you just find yourself in a space and you just want to do the things you want to do. I was having a conversation with a young boy last 2 weeks, and he said to me, I said, why I just take this thing, it's because when I'm with my friends, I want to feel among. But it's not like I take it. But he's already doing it. It's gradually. And then, so there are lots of things that are attached to this. Societal stigma, exposure to trauma. Imagine Boko Haram every day. Today is bandits. Tomorrow is, every day there are stories in this country. So it's enough reason to get people into, situations that will lead them into mental health issues.
Now, you're mentioning this boy also tells us something about the youth. And as always said, they are the leaders of tomorrow. Also, in terms of having some programs to take care of the youth, look at the teeming unemployed youth. Every year, you see coppers being churned out from universities. Every year, these coppers join the unemployment market. Jokingly, some people will say NYS instead of National Youth Service, they will say now your suffering continues. You see, we don't need to reach that level.
Yes.
So what kind of policies should government be bringing out to ensure that youths are gainfully, taken care of?
Honestly, first is important to create awareness that a young man who probably the principal of his child's school just called him to say you've not paid school fees. It's a trigger to mental health issues. And two things will happen. It's either he goes to work and he's doing extremely well, or he moves into his shell and he's isolating. We need to create awareness around mental health. We need to also make government understand that there is no skill acquisition program, there's no empowerment program, there's no, support without mental health awareness. It's very important because there's no amount of money you give to anybody and say, go and start up a business. And you think that the person is doing well mentally without spending the money on something else. It's important to know that there has to be a holistic approach towards whatever, engagement will be for the youth. So if you are organizing anything around employment or skill acquisition, you must understand that mental health is key. I know that the NYC is doing something which is a side, but is mental health part of that? Are they also looking at employability skills, how these young people can be employed? Because sometimes it's not just having the certificate, but what are the attributes? What are those characters that you put in place that when you sit in front of an interviewer, he will say, okay, this person is good enough to be in my office, or I want to have him, as part of my team. So it's important for us to understand that there are basic things that these youths are really seeking. Remember, they're from a home. It's possible that home is dysfunctional. Remember, they're from an environment. It's possible that environment, all they do is sell all the things on the street. Remember that they have siblings. It's possible that there's sibling rivalry in the home. Remember that they are from a nation. It's possible that every day is one story to another. So it means that whatever program you're going to build for the young ones, the youth, you must understand that mental health should be part of it, because that's the only way they can decluster a lot of things that they've saved in their minds to also have, a way forward for themselves. Otherwise, it'll be difficult to do that.
Now, the Chief of Defense Staff, General Christopher Musa, at the point said, look, one of the genesis of the crisis, whether it's Boko Haram, the banditry and all that, is the issue of broken homes. The issue, families are not gelling. You see, even well-to-do parents, children have been abandoned and the parents are taking some vacation somewhere or another. At what point did we miss this family value?
To be honest with you, it's like, I won't say that it just started happening now, but like I will say again, during our own time, we didn't experience all of these things. For every time you want to step out, you must tell your parents where you're going to, the friends you're going to meet, what you're going to do and all of that. But in this case, it is not like that. However, the young ones now are more or less like, in fact, they want to challenge. When you ask where you're going to, the first question they ask you is, why are you always asking? Can't you trust me? They ask you some kind of questions that will make you feel like there is something that you're seeing. That's one. Two, the families as well, they also remember that whatever they give is what the children will also, throw out there. That means that whatever you're doing as a parent, the first thing you have to think about is your child. Is he watching this thing? Is he going to say he wants to do exactly what I'm doing? That means you have to always be the first role model, so that when they step out there, they are modeling you and not modeling someone out there, because they want to do the things you're doing. Most families, they forget that, they have to play a role. They want to leave everything to the principals, the teachers in school and, all of that. They come back home, nobody's asking them questions. What did you do today? And what was the conversation about? Can I see your books? Nobody wants to pay attention to that. The mother goes to work, she's struggling She wants to be the mother. She wants to be the cook. She wants to be the nanny. She wants to go and make sure that she also makes something out, from her office and get back home. They forget that they play multiple roles. And because of that, they also need some time for themselves and also know that whatever they do is what the children will do. The father will say, okay, I'm the one providing, so I want you to do everything. Let the mother take care of the home and the children. Let her be the one to ask all the questions. Let her be the one to look at their books. It's a teamwork. Both father and mother would have to play the role. It's a teamwork. And that's why most times you see parents especially coming from broken homes, you see parents, the mothers will tell you, I wish the father was here. Even if we're not, still married, but at least having some kind of, support so that the children would listen to him and all that. I would say that it's important for families to play as a team. And not just leave everything on one person, and say, you do this, make sure that it's about you. You are the one looking after the children and all of that. So they need to know that whatever the children are doing out there, it's because they have also learned a few things from them and, they just want to replicate. That's what my mommy does at home. So I can do it and it's okay. Remember, the brain is only fully developed at the age of 26. And so it means that whatever any child is doing now, he is still trying to find the right thing to do. So whatever we put in them is what we see out there. And so it's important for us to be role models as parents.
Now, there is something that is cropping in some communities, or it's been there, this attitude of accusing the elderly. Somebody is sick, says that old mother. Somebody has headache, or there was an accident. A whole community is blaming somebody who is asleep. Now, it tends to tear families apart, and it tends to be a thing that is so common these days. Why is it that religion is no longer, playing the role it ought to be?
Honestly speaking, you just made a huge point here, talking about, families always pointing fingers. And I will tell you that until we create awareness and get people to understand what mental health is all about, we would reduce accusing people. It will be easy for us to walk into a place and say, I am looking for a solution to this that is happening to me. Remember that mental health issues, whether we like it or not, we have to also link it to biological factors. We have to link it to genetics. We have to link it to environment. We have to link it to cultural beliefs. We have to link it to societal expectations, right? We have to link it to even the economic factor. So it means that until we create awareness, people will not know that a simple smoking of maybe one drug of whatever it is can pop up schizophrenia, which is mental illness. Until we create conversations that when people begin to exhibit some kind of things, you go to this place of work, they employ you. After 3 months, you say you're tired. You go to another one, they employ you. After 5 months, you say you're tired. You have done maybe about 20, 30 things, and you still cannot keep one. You need to know that the person is struggling with bipolar. So it's not about somebody, pursuing him from their village. It is important that we create awareness that when you find people that are really depressed, they are likely to take alcohol because that is what their own safe space. And science has shown us that there's a link between alcohol and depression. So it's important that we create awareness so that people will see the signs and know, oh, this person is behaving like this because of XYZ. Oh, in their family lineage, there is one person who used to have XYZ, and I think that's why he's also like this. Maybe we should quickly take him to the hospital instead of thinking that it is that, one person. Then, of course, with religion, people don't want to really come out and say, oh, I'm a Christian, oh, I'm a Muslim, oh, I don't want to go to the hospital. When they see me, they will say this, I should have gone to Malan's place or I should have gone to Pastor's place. We need to understand that we should not allow society dictate what we do, but also understand that there are basic requirements for every human being. If you are not doing well or feeling well, it is your right to go and seek for help and not an individual. To remember, so many people that have committed suicide, Their story is gone already. They will just talk about them 2-3 minutes and that's it. So until we create awareness where people understand the link between mental disorder, mental illnesses, and, the fingers that we see people pointing at every day, so that they're able to really seek help. And then churches, mosques will also support. It is only when we create awareness that the church will know that, oh, that woman that her husband is always beating her needs help because she's traumatized, or she's already sinking into depression, or she's struggling with PTSD. It is when we create awareness that the mosque will say, oh wow, that woman that has been coming to report her husband, she will need XYZ services, she will need counseling, she will need this. So we need to create awareness. Basically, we need to get to a point where we educate people, we get them to that point where they understand the basics around mental health and mental disorder and mental illnesses.
Yes. You are the founder of Secure the Future International Initiative. So let's situate your own office, your activities in terms of this mental health management in Nigeria. So what is it you do?
So basically, we try to go into schools to make sure that we create awareness around mental health. But we realized that walking into schools and just stepping out wasn't enough. We needed to do something different, which is the Mental Health School Club, where the students own their program. So they have conversations around mental health. They understand it, except if it's so, severe or something that they can't deal with, then they run to a counselor. We also try to, train the counselors to understand the basics. Because most times when you listen to any Nigerian counselor, they will tell you, oh, career counseling. Oh, I'm in school. I only want to hear what the child wants to be in the future. But it's beyond that. Some of them are psychologically troubled. They are struggling. In fact, some people come to school in the mornings as a result of, a guardian who just raped them or something into that same environment. So we train the counselors to also spot students that are struggling with psychological and emotional issues. We also run a rehabilitation center where we feel that it is important for parents to not, give up on children. Most times you hear parents tell you, I'm tired, I'm not going to do anything again with that child. Whatever is going to happen, let it happen. In fact, you hear parents saying, I've been praying for that child to die because I've spent money. Well, we've tried to create, an environment to say, you also can, really go through some kind of services that will support you and also know how to manage your child. We run activities, trainings, for organizations. We create awareness because we believe that when we create awareness, it will really help. And then, of course, we help organizations to design their policies to suit, at least have a bit of mental health in their spaces so that people are comfortable. If we say people are struggling with anxiety and depression in workplace, what do we do to support them? Of course, it's to make sure that every organization is able to at least have a document, a policy that will protect each and every one that is around him. So we do a lot, in creating awareness and, of course, prevention.
Now, let's still go back to the family as the cradle, the first point when it comes to socialization. And much later in life, what we are seeing today, sometimes we see either child abandonment, a baby is being just left without, as if there are no parents, an infant. Sometimes babies are found in gutter, abandoned. And we've also seen that parents that deserve to be loved, 70, 80, they have been abandoned by their children. What really is happening? That this issue of abandonment, and how do we come out of this?
Okay, so we'll talk about, first let's talk about the one that you said, babies being abandoned. You see, when we don't create awareness on mental health, it will be difficult to know why parents drop their children. Remember that there's what they call the postpartum depression. So it means that some parents might even be struggling with that. And so to them is, I'm not prepared for this, let me just let go. Some it's financial situations. They are not able to look after. Some is an unplanned thing. And so they just say, because we didn't plan it, let's find a way to just get rid of it. Again, for parents who live with their children, but then yet abandon them, you find out that it is the same cycle that will repeat itself later on with the children abandoning their parents because they will say, when I was a child, my mom was never around, so we didn't have that relationship. Most times when you're counseling them, that's what you hear them say. We didn't have that relationship. So I can only visit her once or twice. There was nothing really close. We were not bonding when we were kids. She was never there. She had a job as her primary, assignment, and for her, it was the main, topic, and she didn't bother about the children. You get to hear the children tell you that they are also doing what has happened to them in the past. That's why I said it is important for parents to work as a team. It's important for parents to also know that you cannot give what you don't have. It means that even parents also need help. So when you say, I'm a father, I'm already 60, I'm already 70, and what help do I need? You need help to support your children. Because remember that all you do now is what you might end up seeing them do. Because the brain is still developing, so they assume that whatever they have, learned from you is the best. And so that's what they will do. And of course, if society is not talking about the basics or why parents are also suffering, they feel it's a normal thing for anybody to abandon someone. And then when it's my turn, I do the same. So until we create awareness, that's why I will still tie it back and take it back to mental health. Until we create awareness, we want to understand that so many parents are also struggling out of traumatic experiences. So many parents are struggling because of the bills that they have to pay. So many parents are struggling because of their own background, where they're coming from. Until we create awareness, parents will not even know that they are also going through depression or anxiety or even traumatized,
Yeah. So we look at this issue of the doctors on ground. Their number, you said, is already abysmal there, which also follows that the training institutes there or institutions are also down there, Yet the population is increasing.
That's right.
So how do we handle this? The population is increasing, depression is increasing, mental health issues are increasing. But the training institute, the doctors, they are just down there.
Yes.
How do we?
So I think recently WHO developed a mental health guide, GAP. Okay, and that is to say we have a problem. We need a solution. We have less hands to handle over 200 million people. What do we do? Because if we have just about 150 psychiatrists in Nigeria, how can they manage over 200 million people? That means we need to now upscale the skills of counselors, mental health counselors, psychologists, community leader, that primary health care nurse. We need to get to a point where everybody is almost a mental health first aider, can easily give support to that one person that is next to him, so that we are not just waiting for the psychiatrists. By the way, the psychiatrists have their own jobs, and it's just to diagnose and administer medications. But a counselor is one that will go through the psychotherapy, right? The clinical psychologist is also one that will assess, and administer tests to see if the person is really, also diagnosed. But then again, a counselor is one who will, will go through the therapy with that person. So it's important to create awareness. It's important to build the capacity of people that will support. It's also important to get to that point where Nigerians know that, you are also a mental health first aider. You should be able to give support to that one person in your organization, in your community, at home. You should have one word that you will say that will support the person instead of the person going ahead to commit suicide. So every one of us, would have to get to a point where we're just mental health, first aiders, and we're able to give, support to anyone we find.
I've listened to some patients at the point, or those who went to hospital to see loved ones. Sometimes the complaints against hospital workers are not pleasant, whether they're in the mortuary or even the nurses or the doctors. But sometimes the complaints are more on the side of the nurses. So how do we take care of? You are seen as next after God in hospital, but you go there, this person does not have human feeling to handle. So how do we handle hospital administration?
Yes, so one thing I know for sure is every health worker is trained to understand and have empathy. But unfortunately, when you're overwhelmed, you lose it. You're not able to really give people what you have been trained to give. And so it's important to always get the nurses, the doctors, to take more courses, give them that opportunity to also go and have refreshers, courses, help them to that point where they reduce the burden. I give you an example with myself. After every 12 months, 11 months, the 12th month, which is December, I don't work. What I do is I make sure that I have time to be able to, reduce all that I have soaked inside and then put in something new. So it means that I also go for therapy so that I'm able to come back next year fully charged and ready to support people. So we need to get to that point where, health workers are given the opportunity to also go for counseling. They are given the opportunity to also see the right people that will support them. They are given the opportunity to take refreshers courses so that they know what to do, how to do it, and when to do it. And also remember that there is, that ethics that everybody graduated with, which is empathy. So if you begin to see that you are not giving that, something is wrong somewhere and you should have, where to run to. But how can we do that? There has to be a policy even in that organization. Because when you realize that your staff, everyone is complaining about that particular person, it means that your policy should be able to, cater for that person. Go somewhere, take a break, look for one person that will support you, and all of that at least it will help. I was reading something on a particular organization, but that is in the UK, and they said they said what they do is they give their staff 7 days mental health care only. So you're not going, it's not your leave, it's not anything. If you are struggling with mental health issues, just come, go to the HR. The HR will give you that 7 days. Go and look after yourself. So I think we need to get to that point where we also do that because, they are overwhelmed and so they really cannot give what they don't have.
Now, yes, you see, this issue of patient, doctor or nurse relationship versus, those who are the loved ones to the patient or relations or parents. You see, I tried to bring a doctor here for this kind of a program. He said, no, sir, I won't come. I said, why? He said, society does not appreciate us. And many of us feel... Then he gave an example. He said, how many people have actually touched a dead body, the corpse, but they do in hospitals? How many, somebody is brought smelling all over the place? You could see even those who brought the patient are kind of holding their noses, holding their breath. But when it comes to the doctor, well, we just do it standing. Nobody gives us seats. Nobody says thank you, and off they go. So to him, they are not being appreciated. He said, do you know doctors also suffer depression? So a thing of this nature, being an expert and insider, what's the workings of a doctor, for example, the nurses? How do they feel in hospital?
Of course, it's not easy. It's overwhelming. When you hear some kind of cases, when people sit in front of you, in fact, you're thinking, I hope this person is going to survive the next 5 minutes. When you hear some kind of stories, that they are already sinking inside of you, which is the secondary trauma, right? So really, doctors, nurses, health practitioners are truly, struggling. Depression, anxiety, we struggle with that. I'll tell you, sometimes I struggle with anxiety. I'm anxious. I don't know what's going to come on my table the next minute. So I really struggle with that. But I would say I want to tie that story, to my own experience. That's me now. Sometimes I sit with people that are struggling with depression, bipolar, schizophrenia. But the truth is, I always tell myself that it is me, an individual. I'm doing this because I want to do it. I don't care about society. I don't care what anybody's going to say to me. I don't need anybody's reward. I want to be fulfilled. So I'm not looking for that one person that will say, well done, because you've done well. But I am looking for that one person that I can save. That is for me. I am a different human being. Of course, another person will expect, all the thank you, society hailing and all of that. But again, that is stigma. I will not say because society is not, recognizing me or, not appreciating what I do, and for that I want to hide. It means that personally, I am also stigmatizing myself. Because I'm not, I'm not coming out to tell people this is what I do and I'm excited doing it and I don't really care about the reward. So we have to get to a point where truly, we feel that way it's about us. But then again, what will it cost the society, or a nation to really, support people that are in this space? It won't cost them anything, because just like he asked you, how many people have touched dead bodies? Of course, I have never touched it. So I can imagine that one person who sees it every day and is always touching it, whether you like it or not, something keeps dropping in his system. Okay? He's traumatized, whether he wants to say it or not. Of course, it's his job. So he won't tell you he's traumatized. But the truth of the matter is, secondary trauma is real. You see those flashbacks, you see the picture, you imagine that you're even hearing the person's voice, you hallucinate. You are delusional sometimes because of the experiences, because of what you have seen. Sometimes you hear people say, oh, I walked into a morgue and then I heard people, I could hear voices. They might not be real voices. They might be imaginary voices. But imagine that this person will go home and that's what he keeps hearing all the time. So it's important, yes, that, society really appreciates people that are in this space. But then again, it's also important for that individual to know that whatever you're doing, you're not doing it for that one person, but you're doing it because you want to impact on that one family or that one child who is out there. So for me, I'll say it's about me, to be honest with you. It's not about anybody. Society likes, they appreciate me, they don't. I know so many families that will say, without Dr. Adatu, I don't know where I would have been. And for me, that's enough for me. So it's just to encourage that person that, it's about you. Don't worry about what society says.
Yeah. Now, the issue of the mortuary you spoke about, and mortuary attendance, and yes, like you said, sometimes some of them hallucination at the point, they'll just say they had some voices, and but this is a true life story. I will not call the hospital. At the point, someone felt that his jogging shoes were stolen, and that was enough for him to just point at a boy, picked him, and was locked up in a mortuary for 2 days. And the guy came out. He was just because there were corpses in there, this kind of extreme. We have extremists when it comes to how to deal with human beings. Now, how do we? Because it looks like those people are under some other influences too. How will you lock up a boy in a mortuary? How do we manage such people who are too erratic?
Honestly speaking, I will still tie to, we must learn to create awareness and understand that mental health is described in 3 ways: how we think, how we feel, and how we act. I ask you a question. That person who went to lock up that person in a mortuary, is he okay? It's a simple question. Is that person okay? Because how you think tells me your mental state. How you act tells me. So it means that we have to create awareness. Can we begin to think and have some sense of humor? Can we get to a point where we understand that how we think, feel, and act is the driver of our daily activity, and that means that if you're not doing well, it will show by the way you think, by the way you feel, and by the way you react to things. So we have to get to a point where we continue to create awareness and normalize conversations. That person, I will tell you, is not doing well. He needs to be checked as well. Because if you can go and lock up somebody in a morgue, I would ask you a question. Are you okay?
Are you okay? We'll come to know all of that, especially in maybe accident scenes. where people will rush, they are busy filming. They want to break the news instead of going to salvage a situation. We'll come to that just after this little break to enable us sip some water. My name is Ben Sherman, and our guest is Dr. Adatu Adamu. She's founder, Secure the Future, and that is of the International Initiative, where she is the boss. We'll come to that.
We're talking about South and the North. You talk about middle belt. Currently in Nigeria, we don't have middle belt. North Central is what we have.
Okay.
And they are included in the North. If the perception is because Nigeria is standing on a tripod, you have Igbo, Hausa, Yoruba, they are the owners of Nigeria. That is a very wrong perception. These are major tribes in Nigeria. Simple.
Yeah.
Nigeria is owned by every single citizen of this country.
If you go to civilized nations, they possibly have, stratified their political parties such that those who play at the national level are there. And at the local level, you have other minor political parties playing there. And it gives sense of belonging to every citizen to be able to contest.
And in fact, once you have joined APC, all your sins are forgiven.
It's okay. It's okay. Off your mic. It's okay.
This is Third Eye Africa TV, exposing crime, savaging the nation.
Welcome back. Now, let's look at situations whereby sometimes there are accident scenes. Instead of people to go rescue, people are trapped. Or there is fire, a car is in an inferno, even market or houses. People are busy snapping instead of providing what you call some rescue, kind of a thing. What's this attitude all about?
Well, I would say, technology, social media. Everybody, wants to create content over almost everything, instead of quickly rescuing the next person. Everybody wants to make, a content. Everybody wants to tell a story. But I will say again that it is important that we create awareness. Because when you know that if something happens and you are able to quickly rush the person into the nearest hospital or rescue the person, I think it will save than having you filming the whole thing, leaving the person bleed to death, or the car on, fire and nobody is there to really support. I think it will really help when we get to that point that we begin to think like, okay, this is a human being first. Let me save him first before I tell my story. Or let me do something else until we create awareness, until we begin to see everybody as though we are our brother's keepers. This never used to happen in the past, but things change all of a sudden because of social media. So we need to also understand that there is the positive angle of social media and technology and the negative angle of social media and, technology. We have to always use the positive angle. So if you find someone really in such a space, why don't you quickly support the person instead of filming, and sharing it to the world and wanting to make a statement or telling a story when you can, just save a life? Because so many people, of course, have died as a result of somebody watching them and filming and not doing what he needs to do at that point in time. So we need to, get to that point where we, I don't know, what would I even use? Get to that point where we can just people begin to be in their right minds, using their conscious mind and not the subconscious mind. Because it's the subconscious mind that will always want to rush and take pictures. But the conscious mind will say, let me save. This person is bleeding. So we need to get to that point where we create awareness and get people to, begin to think differently.
And probably that was why you have a National Emergency Management Agency. You have them in state, you have them in local government. But this attitude of mobilizing to rescue a situation appears not to be in us.
Yes, because there is no much orientation. In a community, it will not cost NEMA anything to go to a community
and, make sure that there is a little gathering where they can create awareness. If XYZ happens, the first thing you do is this, is that, is that. Before you take pictures, make sure the person is there. There has to be some level of orientation. People are working with what is on the ground, and what is on the ground like social media. Everybody wants to be on the phone, and that's the truth. So NEMA would definitely have to also do their work. They have to make sure that they create awareness. When we say awareness, it's not just saying we have an office there, but it's also speaking to the community leaders in that space. Whenever anything happens, this is what, in fact, they can even have gatekeepers. Anything that happens, they should call XYZ. You be the one in charge. You do this, you do, so that we create awareness and get people to understand it is important, that you do this. By the way, whatever happens to an individual today can also happen to anybody. It might be your family member, it might be your brother, it might be anybody around you. So if you don't help this person and then it is now your turn, how well do you think anybody can do that? So I think NEMA should be able to do that in connection with National Orientation Agency. They should be able to take these things down, to those communities, to have conversations, to create awareness, to have little centers where that this center is for this. Just in case anything happens, you run to that center, you get someone, they mobilize and come because they already have an idea on what to do. And I will say this to you, Mr. Ben. Will anybody ever do anything around fire, if not fire service? So it means that the only thing we can do, the basic thing we can do is the first aid, which is using the little fire extinguisher in the house or whatever it is, But we have to get to a point where everybody is being taught how to do the basics so that we're able to, support each other wherever we find ourselves. Like I will say again, can we get to that point where people are mental health first aiders, where they know what to do, when to do it and how to do it? It's important that we get to that point where we can, support each other wherever we find ourselves.
One very thing people talk about, they call it LOVE, love. It looks like the love for money is different from the love for humanity.
Yes.
That sanctity of life, and that's why some people can just kill without, feeling like this is a fellow human being, a kind of, you abandon this. Almost like a concluding the part of this discussion.
Yes.
It appears that love has traveled. There is that shortness in supply of love to humanity. So how do we come back to what love ought to be? And it does not matter, I want to follow people of my religion, no, people of my sect, people of my village, people of my tribe. Cutting across.
Honestly, I will take it back to, we need to get to a point where we normalize the conversation mental health, where people understand that very little things can lead to something. And when you talk about love and how it's so easy for someone to just, kill someone without even thinking twice. Earlier, I described what mental health is. I said mental health is how we think, how we feel, and how we act. If anyone can take a knife and put it on someone's neck or hand or wherever, and the person is going to bleed, I don't think that person is very sound. It tells you that there is a little bit of psychosis, because you can't just take a knife and want to, make sure that you see someone go just like that. That is one. Two, it's important that we get to a point where we understand that, we have to love ourselves, though, like, our own family members. You don't say, because this person is not part of me, and so that's not, I don't have any reason to give him extra or do what I should. Back in the days, I will say, your neighbor used to be your next family. So it means that when he sees you doing something, you would quickly want to come and find out what is happening, how he can help you and all of that. But now, it's not like that anymore. Everybody is up and about doing what he or she wants to do. We need to get to that point where we continue to create awareness and help people understand the basics around mental health. Remember again that when people are traumatized, something pops up. So it's easy for somebody who is in the space of I just want to give an example. Someone who has been in IDP camp for a long time without mental health support, without psychosocial support, you don't expect to see any love, because after all, he's been displaced. After all, he's in a community where everybody is just looking for what he or she needs to do. So there's nothing like love. We have to get to a point where we create awareness on mental health. Mental health is how we think, how we feel, and how we act. And you will say this with me, that someone who truly cares about an individual will not want to see the person hurt. But someone who doesn't really care. But then again, if you don't care, what does that tell you? The person could be struggling with one thing or the other. It could be PTSD, it could be trauma, it could be complex trauma, it could be anxiety, it could be depression. Something must lead a man to that point where he does not see love as anything. So we have to get to a point where we create awareness so people seek help and are able to fix those little things that are stressing them and are not making them, do what the society expects of them to do. But until then, we will be going around the circle, looking for the solution. But the solution is creating awareness on three things: how we think, feel, and act, which is mental health.
Yes. Now, sometimes we talk about religious leaders, their utterances, and some will say birds of the same feather flock together. Some will say, by their fruits we shall know them. And it has reached an extent that someone will say, may God hear the prayers of Christians. Someone will say, may God hear the prayers of Muslims. I mean, we have reached a level whereby we pray to one God just to hear prayer of one side. I mean, so what really is wrong with us? Just some food for thought as you make your closing remark.
So I feel like it's important we, look at the statistics that the world is talking about. If we say that mental health, about 300 to 280 million people are struggling with that, then it means that we must put our heads together, forgetting, religion, cultural beliefs, societal expectations, and see each other as human beings first. Though this person is a human being, before the religion, then we can have things, rightly done the way is expected. Until then, we will continue to say, because he's a Muslim, because she's a Christian, because he comes from this ethnic group, because she is coming from this family background. We must first of all see each other as human beings. Then we can attach whatever it is that we can, otherwise we will continue to struggle. So for me, I will say it's important that we get to that point where we normalize conversations on mental health. We get to that point where we understand that mental health is the driver of our daily activities. That means if you are not doing well, you can't give anything positive outside. We must get to that point where, we break that barrier, that thing called stigma, so that people are willingly coming out to share their experiences, whether you're a Christian, you're a Muslim. But the most important thing is, I am looking for support. I know where to go to, and I want to quickly run there. So we must get to that point where we normalize the conversation and see each other as human beings first before any other thing.
Well, it is at this point that we have to end this program. And we've been discussing mental health. We've been discussing family values. How can we come together once again? Show love without boundary, show love without limit, and let it flow like a stream that does not end. And I want to thank you, Dr. Adatu Adamu, founder, Secure the Future International Initiative.
Thank you for having me.
My name is Ben Sherman. Keep watching Third Eye Africa TV. Till then, bye again when we get here again for another edition of the program.